Great to put faces with names, of course. You probably talked to me, most of you, on the phone, Tom, and I really believe the communication, of course, is the key to our success. I've got to hear from you what you need, and hopefully I'll have some input for you, and we can work together as a team. That really, I think, is important. I've been doing this. I'll give you a little background on myself, not because I want to brag about everything I've done, but that kind of ties into all my experience. I started out in Minneapolis at Humboldt Institute for Dental Technology. At that time, I was actually working for Randy and Scott's dad, downtown St. Paul, in his fixed lab, Pat Harrison, and I went to school. When I got out of school, I went right into the Navy. Part of my background, because in the Navy you have to go through dental assisting school too before you, even though I had a degree in dental laboratory, I had to be a dental assistant first. So that put me at the chair side, which at the time I wasn't real thrilled about, but it gave me a lot of experience that I'm using now. I think I can relate to now what the dentist is going through, the time schedules, the working with the patients, their demands and their needs and wants. So I've seen that from a dental assistant viewpoint also. I had the good fortune of great duty assignments. I was at the Naval Academy at Annapolis. We did all the retirees, all the active duty, and all the midshipmen's dental work. There was only 3 laboratory technicians there at that time, so we covered everything, removable and fixed. So it was really a great start in my career. Oak Harbor, Washington was my second duty station. I also was a fixed technician for 18 years. I started, of course, with Pat part-time here, learning fixed, but then I worked for a prosthodontist, actually, in his in-house lab, and I was his ceramist. So for 18 years, I got the background and experience in the fixed area. Last 24 years, I've been doing removable. It's come together very well. I got into removable because I had another prosthodontist ask me if I was willing to hook up with him and do his removable work. So most of my career has been in-house settings, in-house offices. So I really think that gives me an advantage communicating, understanding the receptionist job, the assistant's job, the dentist, what they go through. So all of this, I think, I bring this up just because I've seen a lot. And I want to share with what I think could help us as a team work better together and work good together. So our goals, hopefully, ideas on how to make a better product. Of course, that's what we want to get solved tonight. And I want to have it a two-way street. I want your questions tonight are going to be as important as the information that me and Dr. Dungy perhaps will give out. That gives us information of what we can do better and what you need from us. I understand chair time. The better we can get this product and save you chair time, that's huge. I mean, back in the day, and I hate to say that, but back in the day, I remember when 8 to 10 patients was kind of the schedule for the dentist that I was working with. They'd go into their office and maybe read the newspaper a little bit in between patients. Things have changed. I mean, every place I've been, they're more under the gun now. So if we can save you chair time, that's what we'd like to do. We're going to get into, I know receptionists too. The more we call them and disturb their day, interrupt their time, it's important. So we'll get into our RXs, our RX forms. Hopefully we can get them filled out a little bit better and save phone calls. Chairside tips. Dr. Dungy is going to be touching on some things. We have found that we work very well together. We get a great final result. And actually, since we've been starting to put this together, he's given me some ideas that we've incorporated already just by us communicating, putting this seminar together. So I'm going to share some of that with you. And again, like I said, feedback. Anytime you want to interrupt with a question, or as I get going, if you have an idea that works for you that you'd like to share with everybody, that would be super. And at the end, I think we'll just have a question and answer in case there's something you thought of. Me and Dr. Dungy will answer any questions you might have. Okay, I don't know, maybe you're familiar, but these are 3 types of dentures at Harrison Dental Studio. We have the economy denture, the classic, and the premium. Now the economy we use classic denture teeth from Dentsply. We do just a minimal finishing on our dentures, not a lot of festooning and no stippling. We go down to the classic. We also use economy teeth, but on those we put in the stippling and more festooning, more contouring, our middle range denture. And then the premium is with the IPN denture teeth. Much harder, much stronger tooth than the economy classic denture tooth. Just so everybody knows, custom trays, base plates, bite blocks, 1 reset, that's all included in the price. Sometimes I think I get calls about maybe not using a custom tray for the added expense. It's not an added expense. It's free of charge, and it really, I think, is important for our final product. I'm just going to touch a little bit on the immediates. What I've seen is if there's a lot of teeth involved in the extractions, and I don't know what everybody does, of course, but a lot of our accounts go right to the premium denture, then they can reline it after the healing takes place. I just like to throw out, when there's a lot of healing and a lot of changes in the tissue, perhaps an economy denture would be a better fit at that time. And the reason I say that is we can use that economy denture as a roadmap. So what I mean is if you put the economy denture and midline's off a little, bites off a little, shape, size of the teeth maybe the patient isn't real crazy about, then we switch to the premium denture and we can recover from all those errors. So just something to throw out there and think about. Relining is fine, but if there's a lot of healing, there's too many things shifting and moving, in my opinion. So, go on.
How do you switch from the economy to the premium?
So that's a great question. So you have your denture. It's basically going to end up as a spare for the patient.
Oh, okay. So
you're going to be remaking.
So all 2 dentures.
It's going to be 2 dentures. But here's another thing I just want to throw out. When you switch to the second denture, you have the economy denture. We can take you can take an impression inside that denture, like a reline impression. You can establish the bite relation better with that denture. So we're skipping 2 appointments on that next denture. So, but then yeah, you're making a second one and the patient's got a spare. Initial impression tray. I'm not sure, but we got to express, that's an important step. We can't make even a good custom tray if our stock trays aren't giving us vestibule areas. So it's very important to get as good of an impression as we can with the initial model that we're going to be making a custom tray on. Final impression. I know that saving appointments is important also. So I've been trying to think of ways, me, Dr. Dungy, and perhaps, I'm just throwing this out there, maybe using a base plate and bite block and using that as an impression tray and establishing the bite at that appointment. So you're doing 2 appointments at that time. Again, I'm just throwing this out there. So what we would do is we would make a base plate with a spacer that would have room for the impression material. The only thing, you wouldn't have a handle on this. Again, this is just an idea that I've been thinking about. So I throw that in. Bite registration is important. We have, of course, a lot of different materials come in. And so we're going to talk more about bite registrations later. But what we need on them is, on a base plate and bite block, it's really important to get an accurate midline, a high lip line, a relaxed lip line. Those three things we can really, really use in fabricating the denture. So here's where I think another issue is that we really need to improve on so the laboratory can get a better result. Stabilizing the base plate. The thing to remember is when we're making our base plates, if there's severe undercuts, we're going to block them out. So a lot of times we're getting the base plate back and they're saying it doesn't fit very well. Well, that's because we use blockout material. It's not going to fit like the final denture. So again, this is a subject that we've been talking about. How can we stabilize the base plate? We were discussing perhaps like an alginate. I worked for a prosthodontist who would put a little bit of water on the base plate and sprinkle in, I believe it was alginate, and put it in and stabilize it so he can do these markings more accurately. If it's flopping around, we're not going to get very accurate markings. So we could maybe improve things by stabilizing that base plate and bite block. Anybody have any other ideas on that? I'd like to just have anybody throw out, does anybody use anything at the chair side?
We just use a little powdered fixidant, like the powdered fixidant, and just sprinkle a little bit on there with a little water. And
Okay.
give it just enough stick, especially for that upper, so it's not dropping down.
Okay.
It seems to work really well, and it
Okay.
cleans out pretty easy too.
I think that's so important that, help us establish a better bite and accurate setting of the teeth if we get that stabilized. So this is where some of the bites, obviously we don't have much luck with some of the bites. I'm going to throw out a suggestion, putty. I don't know if anybody uses a putty. I think it's a more controllable material, and the putty is so easy for us to trim back, clean out the embrasures, get it fitting nice and accurately. We can't use much of a small bite and get a good vertical dimension if that's requested. So the blue mousse works good. It's a fine material. The Alu-Wax, the old-time Alu-Wax works really well. But these are some nice bites that we don't have any trouble with at all. So I really want to touch on this because, again, chair time, appointment times, it's crucial, it's critical, it's becoming more and more important. The only way that I've found, and I think it's a pretty good system, is to save some appointments. If a person has existing dentures, let's use them as the custom tray and the bite registration. So in other words, you would take out and remove enough of the acrylic to take another reline impression inside the denture. Now a lot of people say, well, I can't be without my dentures for, a long period of time. But this system, if we do a same day, how many are familiar with same day cases? I mean, we get them in the morning and you get them back in the afternoon, early afternoon. So if you would take an impression of the existing dentures, that's going to help with the periphery impressions. The bite's going to be close because they're wearing these. So what we do is we get these dentures, we pour them up. We would articulate them immediately. This is a same-day appointment now. This would be a same-day appointment. We articulate, we make a putty matrix, of where their existing denture lip support is. So we have all those things done already. We saved 2 appointments. The next appointment would be a try-in. So we could set the denture teeth because we have the models articulated. We send the dentures back to you. So now we have our models on the articulator. We'll make our base plates and do a setup. So again, we've saved 2 appointments. So really, by using this existing dentures, you're down to a 3-appointment denture. That's worked fine in offices that I've been in before. The RXs, just to go over a little bit about the RXs. You know, to help the office staff, you know, mostly is to get these filled out. Patient names, so we can read it, so we can because we put the names in all our dentures, so if we can't read the name, we're kind of calling and bothering the receptionists. Of course, the date and time needed. We have 5 drivers here at Harrison that go out on the road. So if we have a time, that helps them make the stops easily and more accurately on time. Clasps on the flippers, for example, if you don't request, we're going to use our judgment, and we use the retention that is on the lingual of the teeth, and then we probably wouldn't use any clasps. So if we don't have to call about that, that's great. We have a clear class system that we put on more and more partials, and what it is it's actually a system we developed here using a thermoflex material, and we embed that in the acrylic and form it to the shape and size we want. So an option, instead of a wrought wire clasp, is perhaps in the anterior region requesting a clear clasp. We get a lot of requests on that. Denture teeth, I think we covered. Here's the thing, we have the space for denture teeth, the premium and the economy. But if you specify which type of denture you want, we're going to know that. So that's kind of covered with the denture that you would write on the lab slip. Of course, the shade of the teeth. We have ethnic shades, light, medium, and dark. Upon request. Because we make them, we inject them, and we will do that. And we should do more of those because that's important to have at the chair, yes. So give me a call, tell me I really like one of them fancy, or tell me tonight, and we'll get them made up. So, a profile, a picture of the patient's face would really help us determine what shape and size of tooth we might use on that patient. And you can send them now. We just got hooked up. Jim got us hooked up on our own little website at removables@harrisondentalstudio.com. So a picture of a profile of the face would be great. One other thing I wanted to mention.
I just want to insert.
Okay, yep.
We changed this slide today after we printed out your sheets. So the email address is actually not in your handouts, if they want to write that down.
Oh, yeah, you're right. Thank you.
The other thing I just want to mention quick about our dentures, all 3 of them are injected, acrylic injected in the Ivoclar injection system. I went out to New York to Ivoclar actually years ago, and went to their course, and one of the things was they had a old-fashioned pressed and packed denture and an injected denture on models. They hadn't been broke off the models yet. And they showed us by cutting them there in the class and actually showing the space that exists between a packed denture and how tightly fitting the injection system is. So all 3 of our different dentures are all injected. We tried doing a pour technique on the economy dentures. We weren't happy with the result. So we went all to injecting all 3 types. I just want to say that's one thing about the Harrisons. They keep up on technology and equipment like no other lab I've ever been in. So there's nothing. Randy, for example, was just out to Baltimore this last week getting more information on the digital dentures that are coming into the market and everybody's hearing about. They're all digitized pretty much upstairs now.
Maybe, and I'll throw 5-10 minutes into what I saw and kind of what's in the pipeline and where it's headed a little bit at the very end there.
What's that now?
At the end, he'll speak.
Okay,
about digital
okay.
I'll give a
dentures
little,
Okay, good.
a quick little
Yeah,
of what I saw.
because, yeah, the digital industry is coming, so I kind of resisting it myself, but it's coming to stay. So this is what I'm talking about. On a lunch and learn, we can come in, I can work with some of the assistants perhaps. We do that a lot here. I don't mind going in and trying to help. We get models from some of the offices that are just too thin to do anything with. So the one thing I want to throw out there, perhaps you can share this, bring it back to your office, maybe incorporate it. These rubber mold bases are really nice to try to get a better sized base for us. On these, when we get small bases in, we cut retention onto the base and pour a mound of stone to add onto it. When they're this thin, we can't even cut retention into it because we'll go through the vestibular areas. So anything we can help. Another reason I've seen this when I've been into the offices is they'll pour the impression and set it down on the table right next to the vibrator, and the vibrator's still shaking the table and it's just settling. So things like that you can perhaps go over with the staff, and the bases are slick. They work real well. Whenever we bring in new technicians and start training them, I found it easiest for them to start using those and then progressively work their way just to know the thickness and the consistency that they need for it to be firm, and not set it by the vibrator. Like the Blue Moose bites, we need enough impression material in an impression tray. It's just, and I'm not saying any of you do it, but we get impressions that we just can't get a good enough result with even a custom tray perhaps. So burn through is another thing. This is something that I've learned with Dr. Dungy even since we started working. Now this is something I did most of my career, is use in our trays the tripod systems to use as tissue stops so you get the right thickness of impression material in an impression tray. We've been stepping back and just giving a custom tray with no stops. So what we're seeing is more and more of the trays touching the tissue for burn through, and that causes an ill-fitting denture or partial. So we have started and had a meeting today actually, and on all our trays we will be putting the stops on to try to do our end. That's what I mean, a two-way street. Talked to Dr. Dungy, he reminded me that this would be perhaps a good thing to do for impressions, so we're going to start this again. So if you see 3 little knobs in the impression tray, that's not a mistake. We did it so we have a stop on the tissue. So, any questions at this time? I know Dr. Dungy is going to tell you a little bit about his background. He is going to get into impression taking. The other very important thing I think in this is impression taking and stabilization. I think if we can nail them 2 things, we'll get a better product for everybody.